Mouthwashes that have alcohol or strong essential oils or, any kind of antimicrobial mouthwash, it's basically Roundup for your mouth. It's like an antibiotic in that it's going to kill the good with the bad. You're going to kill the bacteria that help produce nitric oxide in the mouth. Even like at the microbiome level, you can see these gum disease causing bacteria in coronary arteries, in brains. That bacteria does not stay in place. I was forced to figure out my own condition on my own because Western medicine didn't give me good answers. The doctor even told me that my diet had nothing to do with it. There was nothing I could eat or change about my diet. The study was done in Mexico, I believe, and they took a large group of pregnant moms and had them chew xylitol gum. So it needs to be the plant-based sweetener xylitol. They chewed xylitol gum for 5 times a day during their pregnancy, and then looked at those children when they were 5 years old. So this is a long span of time. And those kiddos, when they were 5 years old, the moms who chewed the xylitol gum, they had a 50% lower rate of tooth decay.
Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. The lovely Dr. Toni Engram. Welcome to the Pain and Performance Podcast.
Thank you so much. I'm glad to be here.
I'm going to kick this off with something that I read from you that I was like, oh, I'm writing that one down. Your mouth is the gateway to your health. When it's in balance, your whole body benefits. Break that down for us.
Man, it is so intricately connected to all of our other systems. It is the first part of our digestive tract. So digestion starts in the mouth. How we chew, it releases enzymes, different proteins that start the digestive process before we even swallow. It is our secondary access to our respiratory system. So we want it to be like a good backup system, not a primary system. I know you guys have talked about breath and airway and breathing and all those kinds of things. And it's also a direct connection to our circulatory system, because all the pink stuff in our mouth is so highly absorbent that if you take a medication and place it under your tongue, it'll get into your bloodstream faster than if you swallow it. So your mouth is just this gateway to the rest of the body that has its own unique microbiome, and is just so critical to the rest of our health. So I'm excited to be here and talk about it.
It's funny that, I haven't even thought about this. Almost the very first health endeavor that we're taught in life is brushing our teeth. There might be some other things you could kind of throw bathing and stuff like that in there, but we don't really have control over that. The first thing as a kid that you have power over, that we all hate, that you can do for your health is brushing your teeth. And it's an interesting thing that we start there, and kids, this is so important. You have to do it. And then somewhere along the way, even though that's the primary health thing that we're taught as a kid, we kind of I brush my teeth, I do this, I'm supposed to floss, I don't do that enough. But it's this thing that happens, and we probably take it for granted.
Yeah, absolutely. And I would love to change the narrative for any former kid who didn't like to brush their teeth. If you look at toddlers, if they are mimicking you, then they actually love to brush their teeth and love to participate and be autonomous in that. So it doesn't have to be unpleasant.
I'll tell you my funny story about this is, I was taught, whatever age you're taught to brush teeth, I don't know. And I'm not a good rule follower. And so I'm like, well, there might be a better way to do this. So my mom walks in one day and I'm like, what are you, maybe 5 or something like that? And I have soap that I would put on a washcloth, and I would clean each little tooth. And she's like, I'm glad you're doing that. I don't think you need to do it that way. I was like, I was okay doing it. I just didn't want to be doing it the way that you were telling me to do it.
That's hilarious.
Yeah. She's like, I was like, how do I approach this? One of the things that really stood out to me was a few years ago, some research came out. Well, it probably came out a while back, but it first crossed my desk on like antiseptic mouthwash, antibacterial mouthwash. And that was like, all the rage. I don't know, what would we say, 90s, early 2000s. It seemed like every commercial was like new mouthwash, makes your mouth feel great. And certainly something we look at a lot in the healing world is nitric oxide, and can we get blood flow throughout your body? And there was these studies that show like the more we use mouthwash, the lower our circulating nitric oxide levels were. And I was like, how many people are dealing with healing issues, blood pressure issues, and they're attacking all of this stuff, and yet they're still waking up and they're putting something in their mouth, and that is the thing that they have no idea about. That is the root to everything. They can do all these other things to try and fix it, but they're not looking at these oral habits that are affecting it. And like we need to, like, from our practice, look at this much deeper.
Yeah, we're just starting. We're on the front edge of this era, getting out of the era where we would say, just kill germs, kill germs, kill germs, kill germs. And you're absolutely right. Those mouthwashes that have alcohol or strong essential oils or any kind of antimicrobial mouthwash, it's basically Roundup for your mouth. It's like an antibiotic in that it's going to kill the good with the bad. And you're absolutely right. You're going to kill the bacteria that help produce nitric oxide in the mouth. It's also, a lot of these are just really, really acidic. So while they might kill some of the gum disease causing bacteria, they're also lowering the pH so much that it dries out the mouth and actually makes you more susceptible to cavities. So it's like it's helping one problem a little bit, but things are so out of balance. Just like we clinically see when patients are on antibiotics, it can get you out of a mess in the short term, but then we've got some long-term stuff that we need to clean up after that. So you're 100% correct, and it is paradigm shifting, and I am all for it.
Yeah, we got a lot of questions on like, preventing cavities. How do you address cavities? And it was one of the weird things that I don't think I ever really thought about is like, what causes a cavity? Like, why does our tooth break down in there? I heard somewhere along the way, and you can probably disprove this or prove this, that if it left in like the right environment, our teeth were the only thing that would like permanently last to the elements or something like that. It was like our tissues, everything would break down, but your teeth would still be there. I don't know if that's any truth, but it does go to a little bit of how strong our teeth should be.
Right.
And I was like, it never crossed my mind what is happening to actually break down this really awesome, strong, tissue, if you will, in our body that creates these cavities. So when we talk about, digestion starting in the mouth, and we look at like oral health as this gateway to it, what goes wrong? What are the things that happen that start to lead to all of these different, issues, diseases, correlations of health problems?
Yeah, it's several things, like any chronic illness, and that's all that tooth decay is. It's a chronic illness, a chronic infection that we have. And so some of the things that lead to tooth decay, it immediately, like when we just want to get down to what is the definition of it, it is the acid dissolving of tooth enamel into the structure of the tooth. And that acid could come from several factors. It could come from, hey, our mouth is just constantly acidic and we don't have the proper buffering capabilities of the saliva the way that we should. And that's, diet, lifestyle, too much of that crappy mouthwash, that sort of thing. Too much lemon water, we can talk about that. Too much apple cider vinegar, we can talk about that. It could also be, bacteria play a large, large role in this. It's not the only thing, but the oral microbiome is huge. And there are bacteria, these cavity-causing bacteria, that love to ingest the carbohydrates that we eat. So they feed off of sugar. And by sugar, I even mean bread and crackers and chips. Like that sort of stuff turns to sugar in your mouth before you even swallow it. So the cavity causing bacteria will ingest that, but then their waste product is highly, highly acidic. So you start getting plaque buildup in certain areas where those bacteria just really thrive and do amazing and have more carbohydrates to feed off of. I tell it to the kids this way so they understand it, but it's the best visual. These bacteria literally poop acid on your teeth, and it's the acid that eats the hole in the enamel. And if we can catch it early, if we catch it early enough while it's still in the enamel, we can help add minerals back in. We can make changes to diet and lifestyle. We can reverse it in the enamel, but usually once it gets past that outer layer, that outer toughest layer of tooth, into the middle layer, into the dentin of the tooth, then usually we're going to need to still do those lifestyle things, but we're also going to need to do some dental work too.
Yeah, I remember, was it Rhonda Patrick who like went on a podcast and talked about like chewing gum during pregnancy with xylitol in it and reversing? Her dentist was like, man, you had a couple of these starting cavities that are now gone. We started getting questions about it. Like a lot of our patients know that we're constantly experimenting with all kind of different things. I was like, I don't know yet. Like, let me get some experts on.
That is peer-reviewed research. There is a peer-reviewed study that the study was done in Mexico, I believe, and they took a large group of pregnant moms and had them chew xylitol gum. So it needs to be the plant-based sweetener xylitol. They chewed xylitol gum for 5 times a day during their pregnancy, and then looked at those children when they were 5 years old. So this is a long span of time. And those kiddos, when they were 5 years old, the moms who chewed the xylitol gum, they had a 50% lower rate of tooth decay.
That's amazing.
50%. That's huge.
Yeah, that's wild.
Huge, huge, huge. So xylitol is a tool that I use in my office all the time because the data is really good behind it. I personally think that fluoride has too many risks that I'm not comfortable using that as a tool very often. And so I try to steer my patients away from fluoride. And so xylitol is a great tool, and hydroxyapatite is another great tool that we can use to have the same impact that we had with fluoride.
Is that something that your everyday person, should be using or bringing into their habit circle?
I think so. Yeah. Now there are rare caveats. So I tend to attract patients with lots and lots and lots of health issues, like the multiple chemical sensitivity, the canary in the coal mine kind of people are who we get to see. And so I will say that sometimes for some people, and even in my practice, it's rare. I've had, less than 5 that I can count in my entire practice, my entire years of practicing. Sometimes their gut health issues are so sensitive that even using xylitol just in mouth products, gums and mints and toothpaste and mouthwash, sometimes that's too much and it irritates their gut. For everyone else, it does not. And like I said, that's pretty rare because if you're not ingesting it, you're not getting that same prebiotic effect that you get when you swallow xylitol products.
We talked a little bit about like teeth and stuff. The gum disease is probably the biggest thing that I think people had questions on: gum bleeding, gingivitis. I start pulling studies on this, and you look at people who have gingivitis of some sort, and you're like, basically everything I can find is increased or worsened: diabetes, metabolic syndrome, obesity, cardiovascular disease, Alzheimer's, rheumatoid arthritis, pregnancy outcomes, cancer. Like, I know a lot of that is driven, or at least I would imagine is driven through the inflammatory process that gets started with that. But let's dive a little bit deeper into like gum disease. Is there different mechanisms at play there than just the kind of acidic environment that damages the tooth?
When we're talking about gum disease, it really is all about inflammation. Now, that imbalanced microbiome can be the source of the inflammation, but it's all the inflammatory process. And what's crazy is that even like at the microbiome level, you can see these gum disease causing bacteria in coronary arteries, in brains. That bacteria does not stay in place. In fact, we'll even have like sometimes if I can see the gum disease and it's real clear and it's like a hot inflamed mouth, where gums are bleeding and there are health issues that I know are going on or we're worried about, I will have those patients stop flossing until we can get stuff cleaned up.
Interesting.
Because anytime, if you're flossing bloody gums, you are giving yourself a little bacteremia. You are introducing those bacteria into the bloodstream every time you do. Now, if you've just got a spot or two that bleed when you floss every once in a while, yes, we need to address it, but I'm not going to forbid you from flossing. We're talking like the hot inflamed.
Yeah.
Yes. Yeah.
What's the process on that? This is like, if I would categorize all of our questions, this is what we got the most is like, I have bleeding gums and I know like the data says that this is bad. I'm trying to floss more. So everybody listening who has that question, listen to that answer. But like, if we break that down, if we know that it's this bad, and it causes these inflammatory processes, how do we kind of triage this and break down the treatment processes? I know there's multiple factors, and then it's like we're kind of going through testing and then answering. Break that down for us, because this is not something that I think we have certainly talked and problem solved on this podcast, and I know there's a lot of people who suffer with that. Let's go through a sample patient, so to speak, and work through that.
And these are problem solving is my favorite part about healthcare. It's my favorite part of practicing. So when we have a patient with gum disease, first, I can tell just based on my clinical experience, I can get a rough idea of what the primary cause of that gum disease is. Is it plaque and tartar buildup? Is that the primary cause? If so, then our first course of action, first priority is going to be some type of professional cleaning, more than you can do at home. And it's probably, your dentist is probably going to say a deep cleaning or a scaling and root planing or something like that. We've got to thin out the biofilm on the teeth. And if there's hard buildup, that's not something that you can remove on your own. It really needs professional tools to get the job done. Almost like scraping barnacles off the ship.
Yeah.
We gotta get the barnacles off the ship. It's like a splinter in the gum tissue, and we've got to remove that splinter so the skin can heal around it. So
is that something that people need to, I know everybody's like, oh, I go my once a year. Like, if you've gotten to that point, do they need to do like, hey, come back every 2-3 months for a little bit to kind of get that? Okay.
Most likely. Yeah. And just to make sure habit-wise, like if you ever need a deep cleaning, I always tell my patients, if we do this, I only want to do it one time. Because I will see patients who come from other offices, from other places, and they're like, oh yeah, I've had a deep cleaning 3 or 4 times. And that sucks. I do not want that for people. I want you to do it one time. And if my team is doing their job, they're giving you the tools that you need to be able to maintain it on your own. You should not have to do repeat deep cleanings. It should be a one-time thing. So that's if it's plaque and tartar induced. If it's not, if you've got these inflamed bloody gums and I don't see a lot of plaque or tartar buildup, then we've got to do some better digging. We're testing the saliva to see if it's just an improper shift in the microbiome, if we've got some of those more damaging pathogens in the mouth. We're going through a pretty thorough medical history. Like, are there hormone issues going on? Is there an airway issue going on where you're not breathing well at night or you're not sleeping well? We're looking at diet and gut health. Like, are you eating a standard American diet? Or is there a way that we can clean up the diet and get you on foods that are more anti-inflammatory? Is your gut health doing okay? Or do you have symptoms of leaky gut? So we're looking at all of these things to see if we can dig in and find out, primary, at least 1, 2, and 3 causes of it. And then we go from there. Because sometimes the answer is just, hey, let's just do a cleaning, get you all caught up, give you a couple of products to use, and you're off to the races. And sometimes it's trickier. Sometimes it's like, hey, you've done your part in the mouth. Everything that you're doing with your brushing and flossing and water pick and whatever is maybe not getting you past the plateau. And we've got to rope in your functional medicine doctor. We've got to rope in your other providers because there's something systemic going on that we've got to find. Sometimes the microbiome test will show us that we need to use ozone and peroxide and things that will bring oxygen to the area. If you've got a lot of those anaerobic bacteria, sometimes that's not the case. Sometimes we just need to shift, maybe have you do a mouthwash for 2 weeks and then put you on a really good oral probiotic. So it depends on what we see. And that's where I kind of take a more of a functional medicine approach to dentistry.
The saliva test that you do, is that something that people can do at home? Like they take a saliva test and mail off? Is that something?
It actually is, if you want to. My favorite one right now is from a company called Bristle. And Bristle, so that's where we order all of our testing kits from.
I'm
now, the report that I get will be more detailed than the report that they will send out just to patients who order on their own. So it's better if you're working with a provider, but you can order that test directly on the website, and it still gives you great information. So I was working as an associate dentist, so I was working full time based on what the results are. Already had my first kiddo, so I had a toddler at home. Right.
Yeah,
and I was opening my first practice from scratch,
gotten all the
doing the build out and everything,
which is a great thing. I'm
burning the candle at both ends. I was working too hard for me.
Oral microbiome
I've always worked pretty hard. I was kind of a type A person in school. That's what got me to dental school, and I just kept on doing that. But my buddy said no. My buddy said you need to slow down and stop.
Yeah.
So I started having all these. The pH is so different in your mouth than it is losing weight when I wasn't trying to lose weight. That some of those species finally got doctors to listen to me enough. They can't get past the stomach that it's too acidic. Did a colonoscopy, but there is I can pick up. Told me the doctor was surprised lately that I've seen on tests that have have even on my own. So I have a history of here's the damage that's been done in your colon. Did not realize it at the time because this was over a decade ago that I was diagnosed. The most didn't realize it at the time, but there is an oral bacteria. It's Fusobacterium. He said, "Here are your medications that you're going to take. You're going to be on that one until they stop working. Correlated, and then we'll put you on stronger medications with inflammatory bowel disease. Eventually, even those may stop working. Crohn's disease. So there's actually a 40% chance that it's some point you'll need surgery to lose all or part of your colon. And here you go. I was like, whoa, wait, I'm sorry, excuse me, I don't have time for this.
Your practice at that time, was it traditional dentistry or were you starting to already think about this?
Yeah, dude, I just wanted to be normal. I didn't know anything about any holistic stuff. As far as I knew, the holistic dentists were like the tinfoil hat people who wanted to take out all the silver filling. This is what I was told in school, that those were the scam artists who just wanted to take out silver fillings just to make money. That's what I was told. But hallelujah, I got sick, was forced to figure out my own condition on my own because Western medicine didn't give me good answers. The doctor even told me that my diet had nothing to do with it, that there was nothing I could eat or change about my diet. So as I went down all the rabbit holes, had to become my own doctor. I didn't know about functional medicine or integrative medicine at all. I I actually I did take the medications because I was scared not to. The medications put me in remission, which I'm so, so grateful for, because a lot of people aren't that lucky. And that gave me the bandwidth to be able to heal and figure this out for myself. And just the correlations that I kept seeing, it was it was all about inflammation and microbiome, inflammation and this dysbiosis in the gut. And I'm like, well, gosh, that's what I treat every single day. I treat inflammation and a dysbiosis in the first part of your gut. So I just said, man, if I can figure out how to get well myself, then I have the obligation to figure this out for my patients. And so that kind of started me along the road. Now I found it was a very slow process with patients, because patients would help educate me, I would help educate them. We would start talking about diet and nutrition, and they're like, oh yeah, but why are you still using fluoride? And oh, what are you doing with these mercury fillings? So some patients kind of nudged me more towards biological dentistry. But as a practice, it still was an insurance-based, like what I call a drill, fill, and bill type of office. And I eventually, at some point, I just could not keep up with that, because I felt like I was playing both sides. I would have the people who would come in and just wanted me to patch stuff up so they could go back to drinking soda. So I wound up selling that practice and then starting again from scratch in the middle of 2020 in Dallas, like a crazy person.
Yeah. You had stress-induced health issues, and so you figured start a new practice in the middle of a pandemic. I like it.
The type A, it doesn't die easy.
So what were there, looking back at your health issues, were there like clues or changes that you were like, I was off base with that? Like, what were some of those kind of aha things that you look back or changed that you thought were kind of the heavy hitters?
Changes in my health or in practice in dentistry?
In your health.
Changes in my health.
Like, how did you, after you were in remission, were there any lifestyle changes, treatment changes?
For sure.
Supplemental changes, diet changes? Like, what were the things that you went through after that?
100%. So I just started to pay attention of when I felt bad and when I felt good. And I did not feel good when I rushed through meals, when I skipped lunch and was like eating on the go. I did not feel good when I didn't get the right kind of sleep. And so those were like, I started to prioritize those types of things instead of just pushing through like I was taught to do, like I grew up doing, just push through. So it was listening to my body. It was realizing that medically, like, oh yeah, it's actually important to poop at least once a day, and for it to be normal and not painful and not too much and not too little. So never ever. And I grew up in a healthcare family, like nurses. My mom's a sonographer. I grew up in healthcare, and it was never taught that it was important to pay attention to these things. So if things are out of balance, then I tighten up what I'm eating, how I'm sleeping, taking the time to make sure that I'm taking care of myself. Like I set better boundaries. Food-wise, once I started really feeling better, I've done elimination diets. I've eliminated gluten for a period of time. I really can eat pretty much anything at this point, which is so lucky. And so just when things start feeling out of balance again, then I'll tighten up and make sure that I'm not doing a ton of gluten, making sure that I'm cooking at home and not eating out as much. Like I just do good, clean foods that make sense.
What if somebody asks like how does a biological dentist like see things differently than traditional dentistry? I know we've kind of touched around it, but what's your answer to that?
We're really looking at the terrain of the entire body. So biological dentistry, like we stole the name from biological medicine. And in biological medicine, the philosophy is we want to go beyond the germ theory of disease. And the germ theory just says, one germ causes one illness. And so therefore one substance can knock out one germ and cure one illness. Terrain theory is completely different. It's looking at the entire person. So when you hear the term holistic, we're looking at the whole body. And what are we doing to support the terrain? What are we doing to support the body to encourage wellness? And what are we maybe doing to the body that supports disease instead? Like, what do we need to remove so that the body can heal the way that it should on its own? So it's more of a let's lift up the body as a whole, and then let's make sure that we're giving it what it needs to thrive. So like what does that actually look like in practice? We are very, very much into prevention and nutrition because most of the time that comes first. If your nutrition's on point, then everything else gets way, way easier. So nutrition and prevention first, because a lot of times the best dentistry is the least dentistry. And then when we're doing dental work, we want to make sure that we're avoiding any kind of toxic materials whenever possible. So we don't use fluoride. There's no mercury fillings in the office, but even when those need to be removed, we're very, very intentional with how we remove those old silver fillings to avoid a mercury exposure from the procedure itself. We're also looking at some hidden infections, like things around root canals or where your wisdom teeth were removed, sometimes can leave these dead and infected areas. And so that is a stress on the terrain as well. So we want to make sure that we're finding those and that we're addressing them as safely and as naturally as possible when we see them.
Yeah, I feel like that's the area that I look at and I'm like, it piques my interest because like we know, even from like an orthopedic surgery or like injury standpoint, the period after, so like they did a big study on athletes who tore their ACL and which creates, this massive inflammation. You tear the, primary ligament. And what they found was that years later, this was done on NFL players, was that years later, those people who tore the ligament in there had a significant increased risk for cardiovascular disease. And, and basically what that was they created an inflammatory process in their body that, they went in and had the surgery done and fixed the structure, but they never fixed the systems around it. And that led to a lifelong increased risk of things. And I'm like, right now we're doing, everybody, not everybody, but, you would answer this for me. What majority of people are having some form of dental surgery? I imagine it's high if you include, wisdom teeth and, all of these different things, especially now with braces and, certainly treating that. And you're like, that's great. Are we still supporting the body's ability to process the downstream effects of that? That's what it sounds like to me that biological dentistry is going to look at more than, hey, we fixed it. It looks good. Go.
Exactly. And you hit the nail on the head. Conventional dentistry is just amazing. So many advances in restoring the structure of your teeth. But looking at the health of your mouth as it relates to the health of your body, we've kind of sucked at for a long time. And so we're just now like figuring out, what we're doing actually impacts the rest of the body and vice versa. So I'm excited that it's heading the right direction, but man, how humbling, that we know so little, really. As much as we know, goodness, we know so little about how what we do impacts everything else.
Are you familiar with Brian Johnson, the anti-aging guy? I was watching, it was either watching his documentary or watching one of the videos that he put out, and he talked about his like mouth care routine. And it's like, I don't know what the time was, but it seemed like it was like a 10-minute thing in the morning and 10-minute thing in the evening. Yeah. Now, his whole life is like, how can I create the best things that I can do to change habits? And he's like, every second of my day is checked by experts. And it's got to fight for its like habit that lives there. Mm-hmm. And the thing that brought that up to me was like, if this guy has all these experts and they're like, we can only, I think he tries to sleep like 9 to 10 hours a night. So you've really only got like, X number of hours and minutes in the day that they can fight for. And they thought that 20 minutes, which I don't know, you might think that sounds like a little. To me, it kind of sounds like a lot.
Yeah.
It is so important for him to take that time, that over everything else, over, any other things, that taking care of his mouth for those 20 minutes is that important to like anti-aging. And if you listen to him, live forever kind of thing. But it showed like, are we all underdoing it to some degree? Or are we just spending our energy in the wrong places?
Well, and that becomes more of a mental, psychological, spiritual conversation too. Like, how much of our time should we spend trying to prolong life? That's a very philosophical question that maybe we can get to another day.
Yeah, I love that question though.
I do too. But I would say, yes, we all probably underappreciate the importance of creating those habits, but 100%, it doesn't have to take 20 minutes out of your day. Now, maybe there's a phase of your life, if we're trying to get you over a hump, if we're trying to get past disease and restore balance, then maybe it is 20 minutes a day, 10 minutes in the morning, 10 at night for a little while. Kids with braces, like if they're actually taking care of their braces correctly, which nobody does, then it is probably 20 minutes a day. But we can get it much, much faster. And I'm very much a realist, and I tend to not prescribe routines that take a super long time, maybe 5 minutes.
I'm gonna circle back to that. But before we move the nutrition thing, like if we're looking at that, what's the low-hanging fruit of changes in nutrition that are really important if people are prioritizing their oral microbiome, tooth health, gum health? What are the few things that you're like, at least hit these 5 to 10 changes in your nutrition?
Yeah. Well, I mean, the low-hanging fruit is there anything that's just horrible, like cigarette level horrible for your mouth? And can we remove or reduce those? And that would be soda, energy drinks, things that are both full of sugar and highly acidic. Like if you've got a Dr. Pepper habit, I mean, I'm in Texas. I don't know what it's like in Louisiana, but Dr. Pepper is strong. And it is a strong habit to break. And I just can't, there's only so much I can do if you've got a soda habit. So I would say that's the lowest low-hanging fruit.
Because I have to ask, because I have some family members that this will go to. What about like diet sodas? Does that matter?
Thankfully it doesn't have the sugar, but it's still so acidic and is sticky enough that it'll still attract all of those same bacteria. So I would say it's only like 5% better than the regular soda in terms of your oral health.
Gotcha.
And it'll still, like that phosphoric acid that's in the sodas, it will literally pull minerals from the teeth and bones, because your bloodstream has to, like, things are gonna maintain homeostasis, and your bloodstream and your heart take priority. So where are the minerals expendable? It's in your teeth.
Yeah.
So send that to your family.
Perfect. Thank you. Sorry. Carry on.
So sorry, guys. The other stuff, diet-wise, and And again, I try not to be Debbie Downer. So we try to talk about what can we add and make sure that we're supporting the diet in things that we are eating. And that is good, high quality fats. So high quality fats and proteins, because it's the fat soluble vitamins, A, D, E, and K, that are most important for the health of your teeth. So good, healthy fats. I personally think that completely plant-based is more difficult to get all the nutrients that you need. So I like more of like a paleo or a Weston A. Price or something along those lines where it's, tons of high quality animal foods and good anti-inflammatory plant-based foods. So gum health, vitamin C, vitamin E, like the antioxidants are super important. So we want to make sure that we're getting tons of brightly colored vegetables. So that's the main thing. Just nice, healthy, real foods.
Great. Yeah, I like that. What we'll do in terms of time, I'm going to throw some kind of like rapid fire questions at you that we got. The answers don't need to be rapid fire, and we'll get through whatever we can.
Okay, I love it.
How does chronic mouth breathing affect my oral health?
No, in so many ways. In so many ways. It dries out the saliva. It also is keeping you from producing the nitric oxide that you need to produce to protect your heart. When it dries out the saliva, it is shifting the microbiome completely. So you'll have more inflammation, a higher likelihood of gum disease, and you'll have a higher likelihood of tooth decay, because without saliva, you're not naturally rinsing away the plaque in your mouth. And so the bacteria that like to be a little dried out gives them a better chance to eat those carbohydrates that are left over, and they'll proliferate and flourish. That's just in adults. If we're talking about kids, it's this whole other cascade of growth and development nightmares. So if your kiddo is mouth breathing, we have to address it. The sooner the better.
Are you a fan? We had Alex Nice on the podcast who started Hostage Tape, the mouth tape. And as he says it, he's like, bad name, but everybody knows it.
Right?
What are your thoughts around that?
I really like mouth taping. Now, make sure, I always caveat it, like make sure you can sufficiently breathe through your nose first. Like you should try it in the daytime when you're awake, and make sure that you can comfortably breathe through your nose, that you don't get claustrophobic, you don't get like panicky from it, and then work yourself up to being able to wear it all night. Start little at a time, 5 minutes, then an hour, then 2 hours. But as long as you are able to breathe through your nose, then yes, I love mouth taping.
What mouthwashes or supplements or anything in that world, I'm going to paraphrase this, can I use to help with attempted treated gingivitis? Are there any mouthwashes, or are there anything that people can add to like having the test and making some changes to that?
Yeah, for sure. So you can do an antimicrobial rinse. I just don't want you on it permanently. And my favorite rinses when we're talking about gingivitis and gum disease, one really effective one is super boring. It's called Closys, Closys. And it's not super expensive. It comes in a big boring bottle in the drugstore, and it's usually on the bottom shelf because they don't have good marketing. So it's not as popular as your Listerine or Scope, but it also doesn't have like weird green colors to it. So that's good. And it works really well. You can absolutely go more natural than that. So you can do a peroxide based rinse. Those are really nice. You can do something at the health food store. But after a couple of weeks, then I would like for you to be able to wean yourself off, and then let's do an oral probiotic. And oral probiotics are different than the probiotics you take for your gut, because you want a tablet that dissolves in your saliva. You don't want the capsule that can survive your gastric acids. So an oral probiotic is a good way to go after you've used a mouthwash for a couple of weeks. And with mouthwash, you can actually get even simpler than that. Salt water. Salt water does a great job at reducing gingivitis causing bacteria and just kind of maintaining balance, helping soothe any inflammation.
Interesting. Do you have any favorite oral probiotics?
I use a couple of different ones. I use one from Orasana and one from Bristle Health. They actually make a probiotic too, the same company that has the test. And I think they sell it through a different company now. So you can find it in a couple of different places. There are another couple ones that are gaining popularity. I just haven't used them enough yet to be able to say yay or nay on those.
What about toothpaste?
Again, look for something that's really, really clean. I want you to be able to pronounce the ingredients. You do not need fluoride, whether you have cavities or not. You do not need fluoride. It is not essential to preventing or treating cavities. I promise, cross my heart. So if you have healthy teeth and you're not worried about cavities at all, great. Just look for something at the health food store that doesn't have fluoride with ingredients you can pronounce without a bunch of weird stuff. If you are trying to treat cavities, then I want you to use something that has xylitol as one of the sweeteners, and it has calcium hydroxyapatite, and that's the remineralizing ingredient. There are lots of different brands that have that now, but those are the most effective ingredients for making sure that you help remineralize those teeth.
And lastly, what does your perfect oral health day look like? Like you were talking about, you can get it down to like kind of 5 minutes or less. What would that look like to you?
Perfect oral health day. So in the morning, and this can be before breakfast. It can be after breakfast. Most important, I don't want you to brush or do your routine for 20 minutes after you eat. Because you're going to lower the pH of the saliva, and that acid will make the enamel soft and more prone to wear. So be careful of the timing with that. But otherwise, I want you in the morning to brush your teeth with a high quality electric toothbrush. I would like for you to tongue scrape. Tongue scraping is fantastic. And floss. At night, also brush before bed. You don't have to tongue scrape this time. And instead of flossing, use a water pick. That would be ideal routine. Now, does everybody have to do that? No, of course not. But that would be like A+.
Do you, when you mention this, and this is my last one, I promise, chewing time, like of all the things you talked about, I'm like, got it. Chewing time and sitting, going slow on meals is not on my, I have not mastered that skill yet. Is that, I know we've looked at things where they like tell people to just chew longer and stuff. How impactful is that? Is that something that we should go back to counting, sing happy birthday, whatever the method is now?
Right. Or like 100 chews per bite or something like that. I personally I can't ever recommend something that I'm not willing to do myself. So should we be chewing more? Yes, 100%.
Be aware.
Does it have to be 100 chews per bite? That I don't know if that's necessary. I think, in Eastern medicine, I think that's very important. I think Ayurveda is where they really want you to make sure that you're counting the number of chews that you have. So in ancient practices, they tend to be a lot smarter than us in a lot of ways. So I think it would be very beneficial. But do I myself do that? No. But I notice a difference if again, that was one of my triggers back in the early days. It was eating too fast. It was chewing while talking, that sort of thing. So I do sit and try to chew and enjoy my food.
I love it. Where can people find out about the practice? Where can people talk with y'all? Where can they follow you? Give everybody all the details.
Yeah, I would love to. So we're outside of Dallas. We're on the north side of town. We're in a suburb called Richardson in Texas. And the practice website is www.flourish.dental. And so we are happy to see you in Dallas. We've got lots of people who travel, so happy to help you make travel arrangements if that's something that is that would be helpful for you. And online, we try to keep a ton of educational content online. I've got an online course and lots of stuff on Instagram and YouTube. Probably Instagram is where we've got the most stuff. And that is just at Dr. Toni Engram, just my first and last name. And Tony's with an I, Ingram's with an E. We spell it weird.
Well, I love it. Dr. Toni Engram, thank you so much. This was an awesome conversation. And I got through, I'm proud. I got through like 20% of my notes. So
You did well.
so yeah, y'all share what questions y'all have with us. And if y'all hit myself and Dr. Toni up enough, we'll schedule around too and do some deep dives on root canals and all the other fun questions that y'all threw at us. I love it. Thank you so much. Have a great day, Toni.
Thank you.